one of the most common cancer that happens in a woman, that is cervical cancer. Before going into the cancer, you should understand what is cervix. So why are we so much bothered about it? What is cancer? In this video, we are going to look into one of the most common cancer that happens in a woman, that is cervical cancer. So before going into the cancer, you should understand what is cervix. Cervix is the lowermost tip or the mouth of the uterus. That particular portion is called the cervix. Any cancer which happens at that particular point of the uterus is called the cervical cancer. So why are we so much bothered about it? What is cancer? Cancer is any normal cell in a body develops, matures, does its function and dies and falls off, sheds off. This is a normal cycle in a cell. But what happens here is the cell develops before even it reaches its maturity. Due to some kind of stimulus, it starts multiplying, replicating enormously, and then it becomes a tumor and it starts acting against it, and it doesn't function well, and this tumorous growth can become a cancer. So when this becomes a cancer and this cancer happens at the mouth of the uterus, it is called the cervical cancer. So why are we so much worried about this cancer? Because in India, this is the second most commonest cancer that happens in women. So annually in India, we have around 1,22,000 women getting affected by this cancer. So how does this cancer occur? This is due to a virus called human papilloma virus. So what does this virus does? Attacks your body. It starts developing or creating some cancerous changes in your body over the period of time. So there are different varieties of human papilloma virus, that is HPV 16, 18, which are more dangerous, and there are also HPV 6 and 11. So these different viruses, that is HPV virus, can affect your body and in future can develop into a cervical cancer. So once you have the cancer, do you have any symptoms that will tell you that you have something kind of problem in your body? Yes. Early stages of cancer, you will not have any symptoms at all. That is the problem with this particular cancer, because it's very difficult to self-identify in an early stage. So maybe in a later stage, you might have some kind of low back pain, a discharge from the uterus. It could be watery, it could be bloody discharge, sometimes bleeding intermenstrually, sometimes bleeding after a sexual intercourse. These kind of changes might happen only in the later part. So early identification and detection is difficult with this cancer. So how do you protect yourself from this particular cancer? Is first, number one is awareness. That is, you have to get to know that something like this exists. Second is vaccination. There is a particular vaccine which is available, and this is the only cancer where you have a vaccination to completely prevent you from getting or contracting this cancer. And number three is screening. A frequent screening or examination or testing with the doctor is something which you have to do annually so that identify it in an earlier stage itself. Coming to vaccination, you have two different vaccinations which are available in India, that is Gardasil and Cervarix vaccines. These vaccines are completely against this HPV virus, and if you take this, you have complete protection from this virus. So this is the only cancer which is caused by a virus, and it is not just cervical cancer which is this virus causes. It can also cause genital warts, anal cancer, penile cancer, any genital cancer for both men and women. So it is not, awareness is not just for the women, it is also for the man, and vaccination is also for both men and women. But nowadays India is more concentrating on women because it's more common for women, and this vaccine, we have two different vaccines available in India, that is quadrivalent and bivalent vaccine. So quadrivalent vaccine acts against all four different types of viruses, where bivalent vaccine acts against that very important or high risk virus, that is HPV 16 and 18. So I think it is better for us to, if you're affordable, I think there is a difference in the cost, and whichever is comfortable for you to get, I think you should get yourself vaccinated. Any woman or a girl child from 10 years to 45 years old, I think you can have this vaccination done. And it is also available for boys. Boys at the age of 10 years, I think we have to give them this HPV vaccine. Is there a method to early identify? Is there a screening test which is available? Yes, definitely there is a screening test which is available, that is called pap smear. How is it done? I think you have to go visit your gynecologist after your menses. Usually that is the right time to do the screening. And once you meet the gynecologist, they will examine your cervical area. They will put a speculum, see it visually, see for any changes in the cervical area, see for any wound or ulcers or any infection in that area, and through a small wooden spatula they just wipe that area and take. Or nowadays we do something called liquid pap, that is, there is a small brush where we brush that area and send it for testing. So in this there would be some kind of cells which would have been removed from the cervical area. It's not a painful procedure at all. It's very simple, comfortable procedure. And once the pathologist checks these cells, they will tell us whether we have any cancerous changes or whether the cells look very normal and healthy, or sometimes they might even just give us that very simple infection or inflammatory report. So this can be done annually, and any woman more than 30 years of age, I think annual pap smear is very important so that we identify ourselves against these viruses and cancer. Any girl who's sexually active, I think they also can get this pap smear done early in age also. This cancer is through a virus called human papilloma virus. This could be sexually transmitted when you have multiple sexual partners. Like a sexually transmitted disease, this virus can also be transmitted. Vaccine creates antibodies against this virus and your body gets sensitized to it, by which there is no rapid progression of this virus or any symptom related or developed by this virus. As soon as you finish all 3 doses, it comes as 3 doses. Once you finish the 3rd dose, within a month, I think you start having your protective features. I think as much as the studies have done, researchers have done, it lasts forever. There is no limited time duration which is been measured. I think many women have been vaccinated so far in India and worldwide. I don't think there is any reported side effects. Any girl from 10 years of age till 45 years of age, I think this vaccine can be given. For women beyond 45 years of age, there is still no recommendation because their body could have been exposed to this virus in their earlier period of time. Cervical cancer is a very important cancer because this is the 2nd most common cancer amongst women in India, and it affects more in the rural area, and it is identified only in the later part of the disease. So early identification is very important, annual pap smear is very important, vaccination is very important, and then there is a complete cure for this disease.